Welcome to the Dr. G and the Boss Show. I'm Dr. Patrick Garrett. I specialize in functional lifestyle medicine. And then this is Holly Hajaj.
For those of you who are just returning, he's never going to get it. So I'll just say it for him. My name is Holly Hajaj. And I work at the YMCA as the corporate wellness director there. I also teach yoga and work as a health coach. And am happy to be here talking about diabetes tonight. Everybody's favorite subject.
The diabetes.
Diabetes.
And we got Carrie from Australia and Gina. And let's see who else. And then Gina says hi.
Hello, hello.
Tammy's there. Holly just joined us.
I'm here, everybody.
All right,
okay.
So last week we talked a couple times about what?
Yeah, so the last couple of shows, I'll just jump in here.
Episode 100 and 101.
This is 103.
Yo.
So the last couple of sessions, we talked about hormone balance and crazy things that are happening to women when they're over 30 and older, and we talked about how to deal with those things, why it's happening, but then also kind of discussed, what kind of action steps or behavior steps can we take, all of us as individuals, to make it better, which essentially overall was reducing stress.
Yeah.
Which was a biggie. So just checking in with you guys, if there are any of you here with us tonight who were with us for the last two shows, did you take action steps? How did you do? Please share that with us. And howdy do. I just wanted to rhyme a little bit. So.
That's what Suzanne says when she always comes on. She's like, howdy. Hey, there's Jenny, and Missy Richardson says hi. Glad to have you guys on here. Feel free to share this with your friends, especially if they have diabetes. Leanne's there.
Yeah.
Hey, yeah. That's a song.
So I want to say right quick on this, kind of following up and trying to help each other be a little bit accountable. I struggled a little bit this week with the wheat and the sugar, but at work we started our own little challenge between a few of us within our own department, our own branch. And we are now tracking our food every day. We get a point. If we do 30 minutes of exercise, we get a point. And if we drink at least 64 ounces of water, we get a point. And whoever gets to 75 points wins. So these are just some ideas.
Wait, did you say if you cheat, you get a point?
That's what you said.
What'd you get?
You get a point. If you drink water, exercise, and track your food.
Oh, track your food. So if you track your food and you just eat a bunch of crap?
It's one step at a time.
See?
One step at a time. That's awareness. It's building awareness.
That's the Hawthorne effect. That's a good thing. It really is. Even if it's bad, it's good. Because once you know, and then you can make some choices with that too. I see Edna's joined us too.
Hi, Edna. Hello, Gina. My daughter helps me drink water by using my drink water app. Yay! Great idea. Yes.
Yeah, my oldest daughter, she has her Fitbit, or not Fitbit, her Apple Watch, and then we'll be just like watching TV or doing stuff, and then she'll and then she'll start doing a bunch of jumping jacks. And so she's never sitting very long. Her app keeps telling her to do stuff.
It's really kind of fun, actually, I think, the apps. There's some really savvy things out there online to help. So feel free to share as we're talking, but also if you're done talking about your action steps for this last week and just have questions about type 2 diabetes, which is what we're going to focus on today.
We're going to teach you how to beat us,
Dr. G will teach you how to say it incorrectly.
The Dr. Gius will teach you how to beat us, the diabetes.
Wow.
No.
I think we need to work on our material.
Oh man.
For next week.
All right.
So questions about diabetes? Are any of you struggling with it? Do you have any family members who are struggling with it? Let us know what's going on with you for that, and then we'll attend to some of those questions throughout the talk tonight.
Yeah. Hey, Edna. All right, so one of the things is to kind of discuss two things. One of the things is discuss two things.
Ooh.
The first thing is, what the hell is type 2 diabetes, right? So diabetes type 1 is what we typically refer to as childhood diabetes. And childhood diabetes
Hello,
is...
James.
is type 1 diabetes is typical childhood, and you're born with it, and it's autoimmune. Although we're seeing adults acquire autoimmune type 2 diabetes, and that, again, like we've talked about in the past, like any other autoimmune, is just T-cell dysregulation with secondary molecular mimicry.
So that's different. That is
different.
autoimmunity. That's something totally different.
So different.
Not could be caused by lifestyle, or no?
Well,
yes.
Yeah, because that's what ends up causing the autoimmune part.
Okay.
Although we traditionally don't think of it as that.
But the epidemic
Or they don't.
that is growing out of control is type 2.
Type 2, right? So, type 2, though, is acquired, and we used to call it adult onset, non-insulin dependent diabetes, right? And so, really, it came about in the 1950s. So, from Adam and Eve till 1950, you could not cause this disease because it's a sugar storage disease, and we couldn't even import and consume enough sugar, and then we did it. America, we did it!
So, it's
right?
a sugar storage disease.
Yeah. So the average teen now consumes about 140, 150 pounds of sugar added to their diet. And then there's about 150 pounds of sugar that's added to our diet in other forms.
Per year?
Per year, yeah.
Okay.
And in 1910, when we first started gaining weight as a population, it was 10 pounds in 1 year. About 0.8 pounds a month, which they thought was just insane.
Now we're eating a grown adult. We're eating
Yeah.
the poundage of
Yeah.
a full-grown adult
From
in
1910.
sugar. From 1910
Not
to
a
now.
full-grown adult now.
Yeah, okay. Well,
Yeah.
right. 150-pound adult
Yeah.
in sugar.
So,
Hello, Ryan. Hello, Jessica. Thank you for joining us.
we have changed this diagnosis so much in the last, say, 60, 70 years now that we had to rewrite medical textbooks because of this. So the first one is you couldn't really acquire type 2 diabetes till about 35 years of age. You had to have a horrible diet, tons of extra sugar for 35 years before you would saturate every cell to the point where you have so much insensitivity that then you end up with all this sugar just waiting in the hallways.
So when you oversaturate your cells with sugar, that is insulin resistance?
Right. Yeah.
Okay.
That's that first stage.
Okay.
And we'll talk about all that, and basically in a FedEx kind of way. So, then you switch to type 2 insulin-dependent adult diabetes. So we had to rewrite medical textbooks for that. Then skip on a few years, we create type 2 juvenile non-insulin dependent diabetes.
Okay.
So that's amazing. Now we could now the sugar content could cause a child to become type 2 diabetic. And then we created type 2 insulin-dependent juvenile diabetes. And in 2010, we did it, America.
Type 3!
Woo, America!
Yay, type
right?
3!
America! So, we're now, we became the fattest nation on earth, America. And we still have the fattest babies
And we
on
get
earth.
diabetes to the brain.
That's right. So
Can
then,
you tell them about what type 3 is?
Yeah. So type 3 is called Alzheimer-isms, or basically dementia or vascular metabolic dementia. So your brain primarily runs on sugar, and so especially with the use of thiamine or B1, vitamin B1. And so if your brain becomes insulin resistant, then insulin that's bringing sugar to store in those cells is ignored, and then you end up causing vascular disease in the brain too, and then the brain slows down, becomes sluggish, and you become senile, or you appear like you have Alzheimer's.
So what starts to happen when the cells will not accept the sugar or the insulin as the key, and the sugar just stays in the blood?
Yeah.
What happens then?
So the physiology of this is very simple, okay? You have 50 trillion cells in your body, and they all have the ability to store some sugar. so for energy. So they have a certain amount of storage within that room. So just like we have a room and we have a hall here, behind her head there's a door and there's a hallway there, right? So FedEx brings packages of sugar, right? Just like you buy a box of sugar in the store, right? So FedEx is insulin. Sugar can't get into the cells without insulin. So FedEx brings the box, rings the doorbell. You then, as the cell, say, oh, not a problem, I'll just store this over here. Well, eventually you keep storing that 130, 140 pounds of sugar a year, and now you don't have places to store it. So, just like in real life, I would lock one of those doors. And so I would then downregulate a receptor for that insulin, and now there's less doorways for it to approach. So then there's more FedEx guys building up with more sugar in the hallways. And then as they start forcing more and more sugar in, I start downregulating another or locking another door, and I become more insensitive to these guys bringing me sugar. Once that happens and we do a test to see how much sugar's in the hallway waiting to be delivered, then sugar's high. So we'll call it type 2 diabetes. That's it. That's all it is. It's type 2 is FedEx is trying to pack your cells with more sugar, but your body says, okay, we're full of sugar. We've got no place to put this stuff. Because the brain runs off a banana, right? That's the amount of sugar it needs. The average human for a whole day, do you know this? How much sugar does an adult male need in fruit for a whole day?
Let's ask our audience.
Ooh, that's a good question. All right, so for you guys, how many oranges would provide all the sugar you need in a whole entire day?
How many oranges?
How many oranges?
Do. You have to ask. You have to answer in the form of a question. Do. Hi, Kyle. Hi, Dawn.
Oh, that's
hi,
bullcrap.
Tammy.
I was just about to say that.
I
was about to say hi to them.
You need to get on the ball.
Thunder there.
An apple. Okay.
Uh-oh.
2 oranges we have.
Oh, that's bullcrap. How you guys are cheating?
What?
Well, Leanne knew it.
1. That's not true. Maybe one person did. Okay.
All right. So, what? Oh, no.
Half?
Wait. Leanne did not answer in the form of a question.
No. Well.
She's out.
No. We did. Edna answered, and Dawn answered in the form of a question. We will only respond to you.
So, 2 oranges is 100% of the amount of sugar you should be getting in a day.
In a day.
2 oranges. But if you drink 1 16-ounce, a pint of orange juice, you've gotten 200% of your daily sugar.
200%.
How insane is that? Right? Now, that being said, an orange will never make you diabetic. You can eat as much fruit as you want, you'll never be a diabetic.
Why is that, folks? Does anyone know why fruit, whole fruit, unprocessed fruit, in its original form is okay?
That's like Jesus fruit.
Why is fruit okay? Anybody got that answer?
So fruit,
anybody who's watched the show before?
Oh, see, now Leanne says, oh, it's 2 oranges. There you go.
Well, sorry.
So the University of Colorado School of Medicine answered this question through a research project. Okay. So
while we're waiting, can I... Oh, there we go.
How come Leanne knows all this stuff? She already knows all this stuff. That's exactly it.
We're talking about fiber. It's not processed. It includes fiber. Thank you. Yes. So, what happens when you eat fiber with sugar?
Right. So, with fruit has a full of fiber, especially the sweetest fruits that we have. Some of the very sweetest fruits that the doctors will say, don't eat this if you're diabetic or if you want to gain weight. It's bullcrap. It's not true. 80% of the sugar that naturally occurs in fruit binds to the fiber that you don't break down. And that creates this new product called fructooligosaccharides, which you can buy at the health food store as prebiotics, which feeds gut bacteria. So instead of drinking orange juice and then buying the fiber later that you took out, just eat the damn orange, right? And you get it all.
And it's actually so simple, but
all we
have to do is just remember to buy this stuff.
Right? Just eat real food.
Right.
Zero food.
Real quick, can I jump in here, Tammy?
Boy.
Ask a quick question. I
All
just want to respond to her really quick because we'll get to it. She says her husband has type 2 diabetes. His A1C is around 10. He was drinking 2 to 4 cans of pop a day and has cut way down to 1 to 3 a week. He replaced it with iced tea without sugar, but still struggles
Good.
with sugar cravings.
Yeah.
So cravings we could probably talk about
Do you want to talk about that real quick?
at some point. So I can. I don't know in what aspect you want me to respond. But
What about this?
the gymnema.
Yeah.
So there is a
Gymnema.
supplement, an herb. It's an herb called Gymnema sylvestra. GYM as in mother. Gymnema. N as in Nancy. EM as in mother. A. Gymnema
Can't buy that
sylvestra. If you're having trouble with cravings, that is something that you can take. Dr. G, can you speak about it, whether it's harmful or has any side
it's
effects?
super toxic
It is not.
to being fat.
Okay.
See what I did there?
There's a good supplement by KAL, Cal.
Cow, yeah.
That's a blood sugar supplement that's good that you can buy if you're having trouble with that.
Yeah, and what Gymnema sylvestra does is it actually desensitizes your tongue to the taste of sugar. So then that sweetness is gone, so then suddenly it doesn't matter. Now the other part to that is the whole reason we consume sugar, just like wheat and dairy, is because it has this drug-like effect on our body. So wheat and dairy is morphine in there, but sugar is more addicting than crack cocaine, which is why I switched to crack cocaine.
How many of you?
I wasn't done. So, I was just adding the bad joke in there.
Oh man!
You can't just cut off
I gotta
the bad
interject
jokes.
some point when the bad jokes start flying.
All right, so with that sugar, the sugar, just like the wheat and dairy, increases dopamine in your brain, and then dopamine makes you feel great, right? That's why it's called dope. So, Gymnema takes that, desensitizes to that, so then you don't get it. But the other way of doing that is to say raise L-dopamine levels, so then you feel great, so then you don't crave that sugar to feel great. And that's through something called mucuna perennis or dopamicuna, and Now Brand makes that.
And so we're just talking supplements here, but what
But those are
about
great
when
ones.
you said that? I initially started thinking about lifestyle approaches
Oh.
to raising dopamine, which would be stress relief practices and
Right.
not exhausting.
Yeah, even if you sniff lavender, put lavender on your nose, it makes beta endorphins, which then raises dopamine. Exercise raises dopamine. Sex raises dopamine if you do it right. And then running, exercise.
Yeah.
Oh, and hugging and snuggling and all the intimacy things raises oxytocin, which raises dopamine levels too.
So physical touch is important.
So just find a stranger, hug on them, hold their hands, stare them directly in the eyes.
Yeah. Make
And-
sure it's awkward.
Yeah, it's got to be awkward, or you're not going to get the
You're
dopamine.
gonna- yes. Right.
And if they say anything about it, just tell them you're trying to get your dope on, and that's
no,
fine.
tell them you're trying to give them their dopamine release.
The talking phone told you to do it.
It's not about you, it's about them.
Yeah,
Right.
that's right.
So,
Yeah.
okay. So we were talking about fiber before we veered
Fiber,
off
fiber.
into
The oncoming
cravings.
All right.
By the way, keep those questions coming if you have them. That'll help us guide our talk.
traffic. Yeah.
But we were talking about fiber.
So if you take like an orange, has 15 grams of carbs per serving, you only get about 3 grams of that as blood sugar. But if you take orange juice, which has no fiber to absorb that sugar, you get all 15 grams or 100% of this blood sugar. So 80% of the sugar that's in fruits and berries and everything else is bound to the fiber. It doesn't raise your blood sugar. And then that creates fructooligosaccharides, which then goes and feeds your gut bacteria. So those 750 different species, 3 pounds of your body weight, they eat that fructooligosaccharides, and then they make B vitamins, which makes you more energetic, sleep better, moods better, thyroid's better. And then they also makes butyrate, and then butyrate goes and feeds DNA polymerase, and DNA polymerase edits out mutations within your DNA, and then you reverse cancer like you do 10,000 times a day per cell.
Just breathe. Just,
All
Just breathe, everyone.
Just by eating fiber in your food. Not buying fiber so you can eat a bunch of candy and then buy fiber, but just eat real, actual food.
With
fruits,
fiber
vegetables,
in it.
nuts, seed, berry, legumes, greens.
Right. And
See.
thin. Okay.
Say.
Wow, I'm glad that you made it through that. So I have quiz questions for you folks with this in mind. Quiz question. Which is better, juice or smoothie? Juice or smoothie? Which is better?
What about a smoothie juice? Carrie says she likes
Which is better, juice or smoothie?
Metagenol.
When we're talking about raising blood sugar,
Yes.
any answers?
How do you say this word?
Medjool?
Medjool. That's what I thought. Good job. You passed as a test.
Anybody got any answers?
Medjool dates.
Smoothie, 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 smoothie. Lots of smoothies.
Yeah.
Okay, because of the fiber.
Hey, there's
I've
Michelle.
got another one. Which
Yes.
is better, white potato or sweet potato?
Well, that sounds racist.
Or white potato or purple potato? Which one?
What about sweet white potato?
Will you quit confusing the audience? Which is better, white potato or sweet potato? Sweet, sweet. Good.
So when
Yes.
So the question is then, why is the sweet potato
That's right.
less glycemic than a white potato?
Why?
Mm-hmm.
Anybody got that answer?
Mm-hmm.
Do you want to tell us why?
No, they'll tell you. They
Okay.
know. They be knowing.
That'd be knowing.
Dang, everybody got that right too. Oh, see, Carrie answered ha, so that's the answer. Sweet purple, that's the best.
Yes.
Most nutrition.
Okay, why is it better? Why is the darker color better?
So Kim says something. What did Kim say?
Sweet. More fiber. Leanne says more fiber.
Yeah. Leanne needs to be on this show. Like,
Well, we got
some of the stuff here.
a bunch more quiz questions to
All
keep
right.
going.
All right.
Tell us why.
What? Oh, yeah, because more fiber.
Okay.
Yeah. But the orange has more phytonutrients that then go to your skin to prevent skin cancer. And then the purple has even more.
Okay, a couple more on this same thing.
All right.
Dried fruit or fresh fruit? Dried
Yeah.
fruit or fresh fruit?
So,
Dried fruit or fresh fruit?
yeah.
I can speak to this one
Oh,
if I need to.
all right then.
Which one's better?
What about dried fresh fruit?
That is dried fruit. Fresh fruit! Yes! Fresh!
What about grapes versus raisins? You think raisins are better?
Grapes would be better.
Because it's fresh. I knew
So,
that. That's right.
and think about it this way. Let's say you have a dried apricot. Let's say you have a fresh apricot and a dried apricot. How many more dried apricots could you eat versus fresh?
Oh, yeah.
And from my studying, the potency of the sugar, or there's is higher with dried fruit. Concentration,
Yeah.
that's it. Yeah. So the concentration of sugar is higher. And maybe the fiber's broken down? I don't know.
Yeah, that too. Yeah. So, you know, that's great. There was, I was going to say something now, I forgot.
I got one more.
One more?
One more? You guys want one more?
All right, una más, por favor.
Instant rice
Ooh, this is good. Or instant oatmeal.
or instant oatmeal,
Or rice cakes.
right? Or long cooking black brown rice, long cooking oatmeal. Which is better?
Mm-hmm. How come everybody's been getting all these right?
Is this show too easy?
I feel like it's
Have
too
we made it
easy.
too easy?
Carrie talks about the sulfites are bad too in the dried. Especially if they add them. Yeah.
Okay, so here's some things to think about when you're thinking about your intake of food, what you're buying at the store, whether you're buying processed or not processed.
Good
We
job.
want food in its original form,
Whole form.
as close to its original form as possible. So thinking about that when we're eating in terms of diabetes.
Yep. So everybody got it. Long cooking. That's great. See, everybody be knowing.
Good job, Kyle. Good job.
Instant means instant sugar.
Instant diabetes.
That's right.
So with that, okay. So I found some literature tonight that said eating sugar does not cause diabetes. And I've heard this more than just from this literature. Dr. G, can you answer this question for the audience?
They're liars.
When people say eating sugars does not cause diabetes,
then you're asking the sugar companies that question. Because, you know, I think it was Coke. When Coke came out and said something like that. Do you remember? There was this big hoorah about how much sugar Coke has and how it's contributing to diabetes. And then they came out with some kind of statement years ago that was like, sugar does not cause diabetes. And it was like, what the hell are you talking about? It's a sugar storage problem.
yeah.
Yeah, it's just bullcrap. That's not true.
So before we move on, does anybody have any questions?
Questions.
Questions.
Do you know who my dad is?
Papa, can you hear me? Okay.
All right, I got some stats.
Go.
Do you want to do some stats?
You go.
All right. You can jump in there, though.
So, oh, by the way, this one here says that he can reverse diabetes within 2 months. And I'm here to play devil's advocate. Wait, is that right?
Yeah.
I'm here to play
You're
devil's
the devil's
advocate.
attorney.
And say that is not
Isn't that
true.
redundant in the attorney of the devil, too?
Michelle is asking, is diabetes reversible? And that's what our show is about tonight.
Type 2. Type 1 we're not going to talk about. Type 1 I agree that it is. But that's a big argument. Type 2, 100% is.
100% reversible type 2.
That's right. And 100%.
Does it depend on how much damage has been done? Like how long you've been type 2?
I don't think so. I mean, there's probably at some point, but for the most part, I mean, we had patients that had unreadable A1Cs.
Unreadable? They didn't read on the machine.
I didn't even know that was possible.
Okay.
Yeah, and so that was like, I got a nice letter from her sister saying that we saved her life and all this stuff, but holy crap, I didn't know there was unreadable was an option.
Yeah.
But we did it in America. We even got A1Cs higher than machines could read.
Okay.
So.
Okay. So, with that, diabetes is reversible.
So, one Linda Rose says, is okra beneficial? Okay, I grew up in Texas, and that stuff is gross, and it's not beneficial for anything.
Linda, don't listen to him.
It's
I
horrible,
love okra.
It's slimy. It's gross.
It's so delicious.
It's terrible.
Wonderful.
All right. Okay, so not so sweet stats. All right, so I looked up a few stats that were pretty interesting from old slides and then from some new stuff here. But 66 pounds of added sugar directly to our diet. 66 pounds for an adult of just pure sugar. Then there's 150 pounds of things that rapidly convert to sugar. So the average American consumes 150 pounds of either direct sugar or things that convert to sugar rapidly.
And while he's talking about this, think about what your normal intake is. That seems to you, that might seem healthy to you, but actually how much sugar is really there in your diet?
Yeah, and that was kind of mind-blowing with the 2 oranges as our total amount. Or a banana. I watched that special the other day on a TED Talk or something, and they were like, a banana is all you need.
Right.
And I was just like, holy crap. We're way beyond.
Okay.
But I feel like you're rushing me now.
No.
Are you Russian?
Go.
Are you Russian?
Hurry up!
All right. So, 74% of sugar is hidden in processed foods. Kind of like 80% of excess salt is in processed foods. And so our goal is 6 to 9 teaspoons, women to men, but really it's size, which is about 24 to 36 grams. Now, 4 teaspoons is 1 gram. So, if you're in the alleyway and you want 1 gram of sugar, okay, it should look like about 4 teaspoons of
Always got to get at least
sugar.
one in. At least one drug reference. Okay. So 6 to 9 teaspoons.
Yeah, which then an orange, 2 oranges is basically the amount a woman would need for the whole entire day for added sugar.
So, like, what about other fruits? So, like, a handful, is an orange considered a serving?
Yeah.
So when you think about other fruits, it might be a handful, right? According to this.
Well, yeah, like
2 handfuls.
And orange would be 2, so maybe 4 handfuls.
Okay.
And really, if you only eat fruits and vegetables, you're gonna get so much extra fiber to absorb into that other little bit of sugar. It's not gonna matter. I mean, you could eat a gorilla, half its diet is fruit, the other half is greens. So you don't ever see fat or diabetic gorillas unless they're in captivity, which is why there was a study out today about why gorillas have heart disease in captivity, but not in the wild. So,
they've developed heart disease.
Yep, because we feed them. Just like our pets, the number 1 medication is type 2 diabetes medication. The number 2 for our pets is antidepressants. So if they eat like we eat, highly processed, crappy stuff, then they get the same thing we get. See?
Oh.
So it only takes
Makes
1
me sad.
teaspoon of sugar to suppress T cells for about 30 minutes. So for 30 minutes, it can misidentify food as pathogens and then basically leading to autoimmune conditions.
So you become more susceptible just
Right.
to immune system's depressed. You become susceptible to just about anything.
Yeah, food sensitivities, autoimmune. And then the average teenager now consumes over 800 sodas a year, which that's probably where I was in my 20s. Holy crap.
Soda is a really, really, really great place to start. If you have not started anywhere on your managing your sugar intake, soda is a great place to start. And if it, like I think, who was it that mentioned earlier, her husband reduced sodas. If it's just starting small, it's 1 less soda per day.
Yeah.
But the goal is to just eliminate soda. That's a huge positive step in the right direction.
Right. And if you think about this, pretend my hand's a soda. There's 16 teaspoons. 1,
Immune system.
2,
Immune system.
3, 4, 5, 6. Pretty impressive.
That's how I used to
Texas educated.
put sugar on my cereal
Okay.
when I was a kid.
Oh yeah. Or Kool-Aid.
Just all sugar.
So 16 teaspoons of sugar in there. And let alone, if you drink diet soda, you literally will most likely get fatter than if you just drank the damn sugar because it messes up the neurochemistry of the satiation. And you get autoimmune diseases as a bonus.
Interesting. Can you speak about artificial sweeteners right quick? With that in mind.
So I went and lectured about how to reverse type 2 diabetes in 2 months and at this senior center. And this woman said, well, you're going to love it here because we serve super healthy foods. We have diet strawberry ice cream, and then we have blah, blah, blah. And then, and it was just all this horrible chemicalized food. It was just terrible. I was just like, you guys aren't going to invite me back. It was terrible.
But people don't know. People don't know because the education just isn't there.
Right.
And so what?
But you're better off eating straight up sugar. But maple syrup, honey are perfectly fine. They are actually medicine, so you're getting that sweetness that you want through medicine. And then like agave is not healthy because agave is processed just like high fructose corn syrup, so it ends up causing fatty liver disease the same as regular sugar does. And then organic cane sugar is your probably best sugar for making other stuff for other people. And so half the sugar in America comes from genetically modified beets, and then the other half comes from, so that's from South Dakota, and then sugar cane from Florida for the other half of our sugar intake.
I still kind of think just changing what those taste buds crave by going, I'm not going to say go cold turkey, like you don't have to have honey or maple syrup every day. You don't have to have. You don't have to have it. Right?
Right.
So,
yeah, the more you do like unprocessed, more fruits and vegetables, less cooking, your body then will get used to it. So
because then you're not craving it on the taste buds.
Right. And your neurochemistry of your tongue, it only takes 2 weeks to change that taste reception. So like Kim has a question as far as like, what about stevia? And so stevia, when it first came out, I was like, I don't think stevia is a great thing. Like it's non-toxic. It's not going to hurt you. It has no calories, but it's exponentially sweeter than sugar. And so then aspartame's way up here. So you definitely get fat off aspartame. But with sugar, or sorry, with stevia, the theory would be you would gain weight too, because again, it is just going to trick the body into thinking things are sweeter than they are, and then it's waiting for those calories for the satiation, so then people end up ordering and eating more and more food to eventually satisfy that neurochemistry. And then Kim had a question about coconut sugar. Yeah, that's fine. It's just sugar. But it's probably better. It'd be the same as like organic cane sugar.
I think that what we run into the problem with is still trying to make everything as sweet as possible, as sweet to the taste as we want it to be. And so then we run into trouble that way with the diet sodas, with the different processed foods that have a sweet taste or have those artificial sweeteners. It's just masking maybe what the ideal goal would be, which is to not have that need, that that addiction and that need for that taste.
Yeah, and that's weird with patients. You'll see them transition very quickly to where they just don't need it. And Robinson Crusoe's book in the 1700s said, he dreamt of the sweet foods of his homeland, which was don't you dare mess
I'm
that
not.
up
We
again.
just had a good question I don't want to miss that's not on my phone.
So
Can I move it down?
Yeah, just go this way though.
Okay.
Not across.
Okay.
All right, so Robinson Crusoe said he missed the sweet lands of his homeland, sweet foods of his homeland, which was peas and carrots. And so that shocked me when I looked at when the book was written. It was 1700s, before the import of sugar. So then food was actually sweet. So that's what you really want to get back to, is once you stop consuming so much sugar, eventually you don't need stevia, you don't need extra sugars that are like, what's a safer sugar so I can have healthier diabetes? You just eventually just have food that's sweet.
I read somewhere that while you're transitioning your taste buds, you'll go from sweet to salt, and you ideally want to be at bitter.
That's right. Sour and bitter is medicine. That's where people that switch from drinking sodas to kombucha, it's a little bit awkward switch, but when you get that sour is medicine. That stuff is awesome, but it works like soda as far as satiating you, but it doesn't cause the problems.
So it may not taste great at first, but it's something to strive for.
3. You got to drink 3.
Yeah.
And then it'll feel normal.
So we had a question earlier. How do you know if you should be tested for diabetes?
Have you...
What?
Have you had any other lovers that had diabetes? Have you eaten food with...
He's going down the STD route.
Damn it.
And how do you know? You were just
I was
dying
trying,
for
my
that.
wheels were working. I was trying to figure out how can I put that in the same perspective. So typically, diabetes type 2 is a silent killer, right? But nobody dies of diabetes. They die of all the complications. They become blind, and then they lose their kidneys, they lose their heart, they lose their brain, they lose their nervous system. Like my dad was type 2 diabetes. And first he lost some toes, then he lost an ankle, then he lost a below the knee, and then they did above the knee amputation, and he threw a clot and died, right? But same thing for me is like, well, I don't think I have type 2 diabetes. Should I get tested? And so I went ahead and got tested, and my A1C was 5.4, what, right? So it's DNA is not your destiny. I don't have to do what Dad did to get the same disease. I just have to say, I don't want to go down that same road, so I change how I consume food. Now, hell, in my 20s, I should have had type 2. But if you're overweight, in America now we have more obese Americans than overweight for the first time in history, and 80% of those people will become type 2 diabetic within 3 to 5 years. So it is good. I mean, eventually we'll get type 4 diabetes, which is the skinny diabetic. Like, we'll get people have so much insulin resistance before they can convert to fat. So if you get tested, you really want A1C. Just get an A1C. People get their glucose test all the time. It's elevated, but is that just because if your cortisol goes up, your blood sugar goes up? So is it because you're scared of needles? Is it because they hit a tendon once? It doesn't really give you the answer. But A1C is the answer, and A1C in the 5s are awesome, and in the 6s you start getting a little concerned, and about 7 is when you're off the rails. Now they keep lowering this number to get you on medication earlier, but again, everyone should probably be tested at some point just to make sure.
And the A1C, I didn't. I was insulin resistant, but that did not show up on my A1C. It didn't show up until we did a glucose tolerance test that they discovered that I was insulin resistant. We kept testing because I was having symptoms. So I was just going to kind of talk to some of the risk factors and symptoms in general.
That's a great idea.
So increased thirst, increased hunger, fatigue, increased urination,
I gotta go pee.
Unexplained weight loss.
Oh, that's rough, huh?
Blurred vision.
We're insipidous.
And sores that don't heal. Those are probably, some of those are a little bit more severe.
Now we're back to
symptoms.
STDs.
And then as far as risk factors go, and Dr. G talked about it a little bit, but what does your family history look like? And you're going to look at 3, are you still there?
There we go.
Okay, last time we did that, we lost you guys and we were on our side. Okay.
All right.
So, family history. So you want to look at 3 generations of family history when you're compiling that information. And then there are also ethnicities that are from certain geographic locations, have similar genetics, who might be predisposed. So African American, American Indian, Asian American, Pacific Islander, or Hispanic populations. Also, you talked about body fat and weight, high blood pressure, high cholesterol, and an inactive lifestyle. Those are all reasons you might want to consider getting tested. But I just get tested anyway, just to see, because like you said, it's silent. It can be
one
silent.
out of every 2 people in America.
And by the time you're having symptoms, there's some damage that's already happening.
It's been there 5 to 15 years by the time you have some symptoms.
So,
yeah, and you know the pre-metabolic. So you have diabetes type 2 over here, and you have non-diabetic, and it's a continuum. So a lot of times they'll say, well, if you're type 2 and you reverse it, you're always type 2. No, everybody's type 2 if they eat more sugar than they can
if they're overloaded.
They can store, but that's like anything. So it's not a disease. Diabetes type 2 is not a disease. It is absolutely expected normal outcome for what we do. The body in no way can process 60 to 100 pounds of sugar a year. It's not designed that way, and there's a price to pay for that, and that's sugar storage disease, and we can call it whatever we want, but it's the same thing.
I have a quiz question.
Yes.
How do you immediately lower your blood sugar without medication? You can answer this. How do you immediately lower your blood sugar without medication? Does anybody know?
Now I'm curious too.
Anybody?
Does it involve meth?
No.
Because meth addicts are always skinny, and that seems to be they're going to be the non-diabetics of the entire country.
It's the one nobody thinks about, and Leanne is the genius for the night.
She knows everything.
Exercise.
Yes.
If you know you went crazy with cheesecake and cherry pie and a bag of chips, you better get out there and go exercise. Oh, we've got fasting as well. But if we can burn it, we can burn it off right then. We're using it by working out right then and there.
Yeah.
Fasting will eventually deplete your sugar stores through fasting.
Yeah.
But
fasting and
exercise. Fasting and exercise.
So that's good, but that goes back to that thing of like you can't exercise off a bad diet. And so if you do like a really intense workout, like a PX90 or something, and then you have a Gatorade and a Snickers, you've got nothing. There's no gain or no loss.
Yeah, that's what that was going to be one of my questions. Can a person work out and get really fit and be really fit and still eat sugar? Like, let's say there are a lot of people out there who are working out hard. I've met them. They're working out, and so they feel confident that they can eat sugar. They're not overweight.
They just have high metabolic rates for the time being. But eventually they'll crash.
It'll catch up to them.
Yeah.
Okay.
Because that's one of those things, like being fit, like looking fit, doesn't mean you're healthy. And so, like, and then, yeah.
Yeah. So Dr. G is going to talk about, are you getting ready to shift into how do we reverse it in 2 months?
Yeah.
So we got about 15 minutes. Dr. G is going to take us through how to reverse type 2 diabetes
Beat
in 2 months. And go.
All right. So So what's funny is that the American Diabetes Association says on their website we are going to find this cure, right? But they say type 2 is incurable. There's no cure. You know how many patients that have reversed their conditions that are incurable?
How many can you think of that you have worked with?
I don't know. A lot. I mean, I used to do a lot of that. I haven't had a type 2 in a while, but that was a big part of my practice. And it was just, it gets old and easy. It's just, it's type 2. All right, do these things and get rid of it.
Is there anybody with us who's reversed their own or or their numbers are changing? Maybe you've come off of your medication. Anybody who's made successes there?
And what's funny is when we'd have patients that go back to the primary and they'd be like, okay, you're no longer type 2 diabetic. And then I'm just thinking, oh my God, they're going to start referring tons of patients to me. They never do. They never call me. Their primary docs never call me and say, hey, how did you do this thing?
It's because
Never.
the primary doc probably feels that they were the reason.
That's right. So with the American Diabetes Association, they say that stuff. There's no cure, But then they publish research. So the Clinical Journal of Diabetes, volume 22, number 1, they have this patient basically that, he's overweight, 46, so he's pretty young, 206 pounds, average American, fasting glucose of 180, cholesterol, LDL's 142, not too shabby. But his diet is cereal, which is sugar, milk, which is sugar, apple, which is good, turkey sandwich, which the bread is 200 calories of sugar, and then the apple, which is good, Mexican food, which is
delicious.
That'd be okay. Cookies, which is sugar, and then more milk, which is sugar. So, if he eats sugar, he should end up having a sugar storage disease.
And when we say sugar too, let me just clarify. We've already kind of talked about it a little bit, but there's sugar and then there's starches, refined starches, refined carbohydrates, so refined grains and starches also turn into sugar, especially the white ones turn into sugar in the body.
So then, I think it's, 2 months later, his fasting blood sugar is 97. And he lost 7% of his weight. He's still 46 years old. Got his BMI down to normal. His LDL is 93. But when you look at his diet, he's switched from that sugar to fish and steamed rice and vegetables and flax and pecans and apples and regular stuff. So
he still had, and it's showing, he still had milk and cereal.
Yeah, because they don't care about that.
But he added salmon. He added baked fish. He added more vegetables, more whole foods. Put nuts. He added nuts.
Yeah.
And
then he worked out 40 minutes 6 times a week, right? But you still shouldn't even have to do that necessarily. Although, like she said, that's your instant way. You got to burn off all that sugar. So you can deny it, but eventually you got to burn it off.
And if you don't burn it off and it sits in the body, it turns into triglycerides. So if you have high triglycerides as well, that sugar turns into sugar in the form of fat in the blood, which also converts to body fat.
Yeah, so your VLDLs, your very low density lipoproteins, basically is kind of monitoring of how sugar is. You can multiply it times 5 and then that gives you the triglycerides. Unless you do a VAP cholesterol, then they actually count.
Yeah.
So a couple examples we have. So I gave you the example of how the association that says you cannot cure type 2 diabetes published a study where they cured type 2 diabetes just through diet and movement.
Well, maybe they've eaten their words now.
They don't. You've got to find a drug to do it. So then I have this patient, from Oklahoma, And all we did was change their lifestyle, right? So they had a lifestyle that was incompatible with life and longevity that guaranteed that they would get diabetes. And she was 45. She weighed 185 pounds. She was taking the maximum amount of insulin that you can get prescription-wise. In fact, some of our patients that we reversed were buying insulin off Craigslist because they couldn't get blood sugars. So her fasting was 500 on
Wow.
maximum insulin, and her A1C was unreadable for 5 years in a row.
What happens if
5 years.
someone, let's say someone out here has a super high reading like that? What, are they immediately in danger? Do they immediately need to go and get, because of damage?
Right.
Let's say they do they immediately need to go and get on some medication?
No, because you can reverse it very quickly if they change their diet. The medication is, this is how it works. And I'll be very cautious in saying this, but if I live a diet and lifestyle that's incompatible with life and longevity, I'm going to have symptoms for that. But I want to eat crap and I don't want to feel bad, so then I take medications to mitigate how I feel, but the damage is still going on, right?
Yeah.
So the medications will make the blood sugar look better, but it's forcing sugar into cells that don't want that sugar, and then it'll make it eventually worse.
So you're saying someone's not in crisis if they find that out their blood sugar is 500, they can immediately take steps,
Right.
make lifestyle behavior changes,
Yeah.
to immediately bring that down.
Yeah, if they'll make the changes. And this girl, she thought she was going to die. And her sister thought she was going to die too, which she probably was going to die if she didn't do anything. Because that's insane. You're making all these advanced glycolation end products and destroying the eyes and the kidneys and the heart and the brain and the nervous system.
Yeah, it starts destroying and crystallizing those small capillaries and blood vessels, and
Yeah.
that's why it's hard to heal, especially in the extremities. And
Yeah, when I did surgery rounds, we had a woman that was probably about the same age, thin though, but she had a diabetic ulcer on her foot, and the next day when I went to do rounds, she had died. She had thrown a clot and died. So,
oh my gosh.
same as my dad did.
Are you guys still with us, by the way? My phone is thinking, and I can't really tell.
Yeah.
So say hello if you're still there.
So with this patient, fasting glucose 500 on maximum insulin, unreadable A1Cs for 5 years. She just ate a bunch of wheat and dairy and processed meats like everybody else.
Okay, thanks, Edna.
So on day 7, we had her radically change what she did. She had fasting glucose of 88. She went from
Thank you.
500
Thank you.
to 88 in 1 week.
Wow,
And-
500 to 88
And that was with half the insulin.
in 1 week with
Yeah.
half the insulin.
Yep.
Okay.
And so what we did was switch her to wild caught fatty fish, fruits, vegetables, nuts, seeds, almond milk, berries, lots of water, mild exercise, and stress reduction, which
Okay.
is pretty much my protocol.
So right now we're talking about these success stories. I'm going to ask you guys, and Dr. G too, what is the first step? Dr. G, what's your first recommendation for the first step? But also maybe some of you already have some ideas about your first step that you plan to take tonight or this week to start managing your blood sugar better.
Probably the first thing is to start documenting what you're doing,
So tracking.
because most people don't realize, and to look at what even the glycemic index of what you're eating, because most people don't realize that what they're consuming, especially the people that drink juice as a healthy option. Well, I juice. Well, that's just soda.
Yeah.
That is soda.
Yeah.
And I bought into that in the beginning, but I was like, why is there more sugar than a soda in this juice? This is bullcrap.
So soda or juice? Carrie says stop soda. That could be a first step
That's right.
for any one of you. And for those of you who are doing diet soda, maybe
Yeah,
it's
diet soda is going to make you just as diabetic, just as bad.
stop eating donuts. Yes. So if somebody has a donut affliction, it's a delicious affliction, but not good in the long term.
All right, and the second patient I like, because this was a young guy. He's a bodybuilder, and he was 22 years old, 180 pounds. He's on maximum insulin, and he was one that was buying it off Craigslist too.
Okay.
Because he was a weightlifter. He started losing his ability to lift the weight, and he was setting records and all this kind of stuff, and he just started falling apart. But his fasting glucose was 450 maximum insulin. And of course his diet was the same crap. It was just lots of breads and lots of dairy and lots of processed meats. And week 10, so 2.5 months, his fasting glucose was 85. And this is pretty good because I don't know if you guys know what a miracle it is to help any 20-year-old help themselves with anything. But even a guy at 22 actually making changes, that was amazing.
Oh, look what James Todd Hawkins wrote. Oh, that's sweet, James.
So, week 10, fasting glucose was 85. Completely off insulin by week 10.
Okay.
And again, switched him to wild-caught fatty fish, fruits, vegetables, nuts, seeds, berries, legumes, and greens, lots of water, mild exercise, and stress reduction.
Okay.
And so really, it's very simple. I even kind of like, it's kind of like with Crohn's, reversing Crohn's and stuff. It's kind of like...
It's simple in theory.
Simple.
It's simple when you talk about it on a TV show.
Oh, it's simple.
Online.
They just
it's
have
simple.
to do it.
Doing it, implementing it, and then doing it consistently.
Yeah.
That's what's difficult. So, what kind of supports can you create for yourself?
Oh, pantyhose are great support.
Thank you. So, what supports can you create for yourself to help support you moving forward in the thing that you want to do next? So, if say you've already done soda, say you've already done, maybe you want to look at your grains intake. I know we had someone also who mentioned the keto diet. Can you talk about...
No, I'm going to piss people off. I'm not talking about that.
Okay.
So...
It's a short-term solution, but
Yes.
not really a long-term solution.
Yeah, and I don't know. There's lots of people that do keto. There's lots of people that do paleo. There's lots of people that do whatever. But that's not what I do. I just do, let's live a lifestyle that's consistent with life and longevity. Let's do what the healthiest, happiest, longest living populations do consistently.
Yeah.
Let's do what animals in nature would do consistently with food. Same things if you crashed on an island and you had to figure out how to eat, you just walk around and eat stuff, and that's all it is.
Yeah, so Dr. Garrett's approach is also based on the blue zones, which we've probably talked a lot about in a lot of previous shows. But these are the areas where they're living a life that's conducive to longevity. They are not doing the keto diet, is essentially...
Yeah, if you do keto or if you do paleo or if you do any of those, that's great, as long as it's working for you. But eventually just switch to real, actual food. That's what you want. Or a healthier version. I mean, keto can be healthy. Paleo can be healthy. But it's kind of what it's evolved to is a little bit different, though.
I think what people are looking for is a jump start as well. Like,
yeah, those are great jump starts.
When you're feeling like so bogged down, you just really need a powerful intervention. And I think those are good for that as well. Especially also just learning how to eat whole foods and things like that. You learn from those things as well. They're not very maintainable, but starting somewhere is great.
And one of the things with food, so there's a couple of success factors that will really help you here. One of them is eat foods that are appetite suppressing by themselves. So things that are really fiber rich are going to take up volume, and your stomach will start shrinking and shrinking and shrinking to the point where this extra volume fills you up. So a lot of times when I started doing kind of raw vegan a year ago, I'm flexitarian. I do what the hell I want, but I mostly eat raw vegan, and holy crap, it takes nothing to fill you up. Like, it's crazy. And we're used to, I could just eat a ton of food. Now you eat a little bit of something and you're just like, oh my God, I'm so stuffed. And so foods that have lots of fiber, so especially apples, and apples also have an anti-inflammatory quercetin that's in there, same as onions. Pine nuts, which you got to take out a small loan for because they're freaking expensive. Flax seeds, which are cheap, but buy them whole, grind them yourself, put them in the freezer in a glass jar, scoop them out maybe a teaspoon or two a day. Oatmeal, certified gluten-free, Bob's Red Mill, dirt freaking cheap way of eating whole grain, low carb. Spinach, mescaline, endive, kale, whatever, chard. Tons of fiber, tons of nutrition. Soups, there was research that said broth soups or veggie soups had a 50% increase of weight loss because they're very filling, very satisfying, and then they're very low cal, especially like a, what's it called? Miso. And then kombucha, because it's fermented, kombucha, there's a studies from Arizona where they said, they dug up some old studies and they redid them because it just sounded too good to be true. But they said 2 teaspoons of apple cider vinegar 2 minutes before you eat is just as effective as metformin without messing your body up from metformin. So the same thing with drinking kombucha with your food. That way you don't have to drink apple cider vinegar. Mm-hmm. And then supplements, things like dopa mucuna, gymnema sylvestre, those then again change the physiology to where you're not craving, you feel satisfied no matter what. And who is it? Missy asked about sprouted grains. Yeah, sprouted grains.
Sprouted grains are a little bit more easily digestible.
Yeah, more nutrition in them though too. And then the second success factor is restoring a low glycemic, low calorie, nutrient dense whole food diet. So eating mostly vegetables, eat the rainbow, lots of fruits, vegetables, nuts, seeds, berries, legumes, and greens, and healthy omega-3s. And then also, with the high glycemic diet, it not only disrupts that glycemic insulin balance, but it actually will raise growth hormone and cortisol and epinephrine, which then makes it more likely that you'll get cancer. And studies came out a few years ago that 100,000 cancers, and including 19% of just breast cancers, are due to one factor, and that's sugar. Mm-hmm.
It's worth it to consider. Gina says, eat the rainbow.
Eat the
We're
rainbow.
not talking about Skittles.
Oh, man.
Booze.
Skittles. You know what Skittles parties are, right?
No.
It's where you take all your medication and you put it in a bowl, and then everybody just grabs some and...
That sounds healthy and not dangerous at all.
Super fun. No. So, then, before we finish here.
Okay.
So, one thing is to look at like a basic glycemic index chart, because this dramatically changes how you should look at food. Because if you look at the low glycemic stuff, it's all the stuff that a diabetic educator will tell you not to eat because it's full of sugar, but it's actually some of the lowest glycemic food there is. So all the berries and the fruits. So again, it's what we do. So this is what we do in America. We say, don't eat real food, eat processed crap, and then we blame food. So if we drink a bunch of juice, we get too much sugar, then we say fruit is sugar, so don't eat fruit. But it's the juice that causes diabetes, not the fruit.
Yeah.
And then as we change the food, that's where Americans kind of demonize and say, well, carbs are the problem. Carbs are making everybody fat. Unless you live in Asia, Japan, and pretty much every other country in the world. But what do we do different? We process them very differently because we make them instant sugar. Same thing with oats. Well,
and then
oats,
we become addicted to them and we overeat those processed carbs.
That's right.
That it become dominant within the diet.
Yeah. The same thing with oats. We take whole grain oats or steel cut oats, reverses diabetes. What about old-fashioned oats? That's a little bit more processed, a little bit higher glycemic, but still in the safe range. But then if we make instant oats, then we end up with diabetes.
A sugar meal.
Sugar meal. So we mess up the food, and then we blame the food that prevents everybody else in the world from becoming diabetic. But for us, it becomes this big quandary and becomes very confusing for people. But that's where you just go back to, what do the healthiest, happiest countries do? What would I do if I was on an island? I just eat fruits and vegetables, nuts, seeds, berries, legumes, and greens in mostly whole form.
And then, so if we had to kind of sum this talk up, the 3 main things, we're looking at diet, we're looking at stress relief, because stress is also a factor in blood sugar imbalance, and then exercise. Those are the big 3,
Yes.
Wouldn't you say?
Yes. And with exercise, there's 3 ways that you're going to burn energy. Like we're just sitting here now, we make what's called we're making creatine phosphate pathways, which make 1 unit of energy, which burns no sugar and has no oxygen. But if we lift weights, right, we're doing what's called anaerobic glycolysis, and now we're burning sugar without oxygen, and it makes twice as much energy burning as us just sitting here existing.
Okay.
But the minute we breathe harder, the minute you can't catch your breath or you can't talk very well while you're exercising, then you're doing what's called aerobic glycolysis, and now you're burning energy 36 times faster, which means that if you lift weights, it's going to be harder to reverse type 2 diabetes. But
if you lift weights only.
Right.
Yeah.
But the minute you start breathing harder, you walk faster, you do things that make you breathe harder, then you burn energy 36 times faster. And you're burning sugar, fat, everything in the presence of oxygen. And that becomes one of those sustaining ways of reversing type 2 diabetes the fastest, just like Holly was saying.
Yeah.
So you go the why, but do things that you enjoy, play some racquetball, play some tennis.
Breathe a little hard. It should be a little bit difficult to speak a full sentence.
Yes. And I have a patient that loves the Stairmaster.
Everybody has a favorite
Crazy person is
something.
that.
So basically, the key to reversing diabetes is to manage those sugar levels within the body.
Yeah, it really is very simple. It is very, 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 very simple to reverse type 2 diabetes. It is just the knowledge of really how to cut through all the bull crap.
And then take the action steps in the face of a constant barrage of commercialism,
Right.
in the face of addictions and cravings and things like that. So you might think also within this talk about what are your barriers? What do you think your barriers are? Really think about those. How can you plan or strategize to overcome those barriers, because they're there. The trick is changing that behavior over a long period of time so that it becomes normal to manage.
Yeah. And the worst kind of patient ever is a patient that's compliant, because then you run out of patients very quickly. And then you have to get another patient. But I'm telling you, I don't know why I haven't really been talking about diabetes or something, but I used to have a ton of those patients. But it just sucks because they get better so fast. And then you're just like, okay, I guess we'll get a different patient.
So have we answered everything that you wanted to know within this talk? If not, please send us that question. I'm going to make Dr. G write those down right now so that we can follow up on those. Yeah, I am.
Did I make a drug reference already?
You already made a drug reference.
Check.
So if we did not answer, if you had something inside and you're like, yeah, but what about this? We want you to say those things to us. So
yeah.
Let us know how we did for this talk, and if you have further questions, we can always revisit those things next week or whenever the next show is.
Which is next week.
I don't know if we're gonna have it or not, but also,
am I retiring?
What are your action steps for this week? We talked about that last time.
SMART goals.
What is your SMART goal? What are you going to do that's realistic, that can be something that you can do every day? That's one small step towards ingesting less sugar, exercising more, and reducing your stress.
Yeah. And as a public service announcement, saying that 1 out of every 2 Americans is either diabetic or pre-diabetic. If you have slept with a diabetic, you should probably get tested for type 2 diabetes.
Just do what you will with that. I am not going to support that statement. So,
Sorry.
okay, we will see you next week and try to follow up on those questions. Thank you for joining us as always. We don't have topic next for next week yet. So, if there's something you want to know about,
what about SSRIs are bullshit?
Oh, that sounds interesting. So, talking about mood, depression, anxiety. What do you guys want to know about next week?
Yeah. You guys tell us, and then we will write a whole thing from scratch. And I will have to come up with new drug references to suit that.
All right, we'll be thinking about you. Have a good week. Good luck with your action steps.
Bye, you guys. Love you for attending. Thanks.